there is room for what we call nutrition by addition in every single person's diet. So we spend less energy saying like, don't eat that anymore, which is, just creates shame and makes people feel like they fail. Instead, let's talk about what's missing. What's missing from your plate? And we teach them how to think scientifically about food.
Right.
And to cut down the noise that's on TikTok and many other places where patients have all these ideas and they don't know what to believe. And we need to be part of that.
Welcome to Learning from Leaders, a podcast from Southwestern Medical Foundation where we dive into a world of wisdom, mentorship, and innovation, exploring the insights and life lessons of seasoned community and business leaders. I'm Michael McMahon, President and CEO of Southwestern Medical Foundation. I invite you to subscribe now and join us on this empowering journey of growth and leadership. Now, let's learn from the best and drive meaningful change together.
Welcome to Learning from Leaders, the podcast where we explore how community leaders are creating impact and inspiring others. Today, we are talking about food, and more importantly, how food plays an integral part in overall health. Our guest today is Dr. Jaclyn Albin, an associate professor at UT Southwestern Medical Center and a nationally recognized leader in culinary medicine, a growing field that blends nutrition, education, and clinical care. She founded UT Southwestern's Culinary Medicine program and leads the medical school's efforts in training the next generation of healthcare professionals to see food as a powerful tool for health. Dr. Albin, thank you so much for being here today.
Glad to join you.
Well, to get us started, I kind of want to go back to the beginning of your career. What was the start of your journey in medicine?
Well, my parents have this story that comes out every Thanksgiving about probably when I was 3 years old, I started making medical kits, and I would try to steal all the Band-Aids and Q-tips, whatever you could find around the house, and announce to everyone I was going to be a nurse. And my dad's slightly gentle way of telling me, honey, you're sort of the bossy member of the family. We think that you should go to medical school. And he told me that repeatedly. And about age 12, I knew I was going into medicine. All my family members are farmers, teachers. We got a pilot. And no one had been in any medical field. So I had no idea what I was signing up for. But once I made my mind up, it was straight journey and all the way through.
Yeah. And what was the beginning of thinking about kind of the combination of food and medicine?
So that was personal. And I think most people that you talk to who do food as medicine work have a story about where the traditional approach to medical care somehow was missing a piece for someone they loved. And that's exactly what happened to me. So I went into medicine. I went to the East Coast for medical school. I met my husband on the metro there, which is another story.
Oh my gosh.
Yep. And he was not in medicine at all, but he followed me to residency, and I did residency in Houston in combined internal medicine and pediatrics. And so I'm roughly a first or second year resident when this happened. So I'm training to be a pediatrician and an internist. And you would think that that broad spectrum of training would equip me to take care of almost anything, right? Well, he comes home one day after a medical appointment that I had sent him on because I was worried about him. And he says, I have celiac disease.
Okay.
They didn't tell me what to eat. I don't even have a handout. I hope you know what to do.
Wow.
And I had that moment where the emoji head exploding,
right,
where I thought, I have no idea what to tell you. And I'm still in training, so maybe there's more to learn, right? But there wasn't. I didn't get any more about how to equip patient care and food in the same sentence. And my mom got breast cancer the next year. She got sent to a dietitian who specialized in cancer-related care, which is something that we do really well at UT Southwestern in supporting the nutrition journey in cancer. But that opened my mind to literally everyone needs to talk about how food affects their health.
Right.
Why don't we learn that?
So how did you what was the point at which you found yourself at UT Southwestern?
Yeah.
And then leading into kind of like the idea for launching this program?
So somewhere towards the end of residency, you have to decide, what am I going to do next? And I did an additional year as a chief resident at Texas Children's Hospital on the pediatric side. And during that year, I learned that UT Southwestern was about to build a combined Med-Peds residency program. And it was actually at my high school homecoming. I was in town.
Oh my gosh.
And I was lamenting to my high school principal at the football game because I'm one of those people at football games. I talk, I don't watch the game.
Oh, I'm the same way.
So I'm there, I'm talking. And I said, I'm so sad I can't move back to Dallas because my family's here because they don't have Med-Peds. And I'm not going to go somewhere that doesn't have Med-Peds. He goes, oh, I know someone. They're getting it. You should talk to her. And so then he connected me to my division director, who's vice chair of faculty affairs in pediatrics, Jennifer Walsh. And so Dr. Walsh brought me in and said, do you want to come build this program with me? And I said, yes. And so I came in focused on building education, which was a key part of my early journey. And then later, about a year in, the medical school curriculum changes and they said, we need someone to teach nutrition in a creative way. Hey, Jaclyn, you bring your lunch every day. Can you do it? Because it looks kind of healthy and none of the rest of us know anything. That is literally what they said to me, which I think is a great story because sometimes just how you live out your own life is how other people know you care about something.
Right.
And when it's authentic and real for you as an individual, then it's obvious to other people that it's something
a big message.
Yeah, you believe in it. So that was literally the beginning for me. And so I'm here building a residency program. We actually just matched our 10th class
Congratulations.
in combined Med-Peds. They're amazing people, and I'm so proud to be part of that program. And it taught me so much about education. And part of what's amazing about medical education, whether you're talking about a medical student, a PA student, or resident, is it's always evolving because we're always learning how we can teach differently, how a particular generation learns, and we're also learning what's new. Medicine's evolving, even the things that we're discovering constantly in our basic science and translational programs at UT, we have to figure out how to teach those.
Yeah.
So the beauty in that is there's always new ways to teach, and that opened the door for me to have sort of a crazy, creative, let's take them to the kitchen program.
So now, kind of 10 years into your 10th match cohort, how unique is this sort of program at UT Southwestern or other medical schools doing programs like this? What is standing out about UT Southwestern?
So actually, my residency program is not the focal point of culinary medicine. Culinary medicine touches many programs, and I'll tell you a few examples in a second. But my residents were my petri dish for thinking about medical education as a way to innovate. So what I love about Med-Peds as a specialty that UT Southwestern has really given us so much space for is how do we think about the life course of someone's disease, sickness, prevention, and then pairing that with my work in food as medicine and culinary medicine was, hey, what we're doing in pediatrics is the beginning of our story. And then adults who come in are reflecting a lifetime of what they've been exposed to. Food is such a huge part of that. So we started taking medical students into the teaching kitchen, which is in our School of Health Professions, and lots of people are taking medical students into the kitchen. It's a cool opportunity because we teach them to work with dietitians and other health professionals. We teach them how to talk about food in a non-judgy, actually helpful way,
right?
Which many people have a funny story about not maybe getting such great advice from a physician. So how do you actually talk about food when someone's vulnerable? And we teach them how to think scientifically about food.
Right.
And to cut down the noise that's on TikTok and many other places where patients have all these ideas and they don't know what to believe. And we need to be part of that. So we celebrate culture in culinary medicine. And in fact, we feature spice profiles and things that will resonate with people across all different cultural backgrounds. There is room for what we call nutrition by addition in every single person's diet. So we spend less energy saying like, don't eat that anymore, which is, just creates shame and makes people feel like they fail. Instead, let's talk about what's missing. What's missing from your plate? And instead of me telling you to have less of this and less of that and less of that, I'm going to tell you what to put on your plate. And then hopefully I'll just kind of shove the other things to the edge over time that don't need to be there in such large quantities. And so I think not everyone's ready to change, right? It's the same as smoking cessation conversation. If someone comes in and they are not ready to quit, I'm not going to spend 25 minutes on it, right?
Yeah.
But if someone comes in and they have resistance at every topic, they're not ready. And I can just say, you know what? I am here for you if you are interested in learning more about how food can play a role in your health and healing, because I have a lot of ideas for you that would still fit your family's cultural pattern. And then when they're ready, maybe it's that back and forth. It's like, oh, okay, well, have you ever tried using corn tortillas instead of flour? They're actually going to have a lower effect on your blood sugar. Could we do that and still have the taco night or enchiladas or whatever? Or let's talk about pastas. There's legume-based pastas, made from lentils, made from chickpeas. Could we maybe try it, see if we like that? Do we like it? Do we want to blend it? Oh, we don't like it. All right, well then let's just lower the quantity of pasta and add more vegetables.
Yeah.
So that we can balance out the amount of carbohydrates that we might be getting in diabetes or another condition. So it just takes a lot of nuanced conversation. That's what chef dietitians are uniquely skilled to do. And where I feel the key in building this is going to be training up a generation who's passionate about nutrition and food. And then how do we make it pragmatic?
Right. And it's like personalized medicine.
Absolutely.
Depends on the individual for a million different factors that are that vary individual to individual.
I mean, the dietary guidelines for Americans, which may have some minor changes, we've already had the scientific report released for the 2025 guidelines, so we'll see what the official guidelines look like. They haven't changed that much, right? Eat fruits and vegetables, legumes, nuts and seeds, whole grains. Less animal protein is a general trend. Not that we have to eliminate it, but that doesn't actually tailor to any person's life or preferences, and people need so much guidance to tailor it, especially when their health is at stake.
Right.
But we took a broader perspective, and what's not happening everywhere is teaching this to residents and fellows.
Okay.
And bringing in whole teams. So we bring in our GI fellows in both the adult and pediatric departments. Yesterday, we had our endocrinology fellows talking about what about the calcium in our diets when we have a dairy allergy or we have some other medical reason why kids can't have dairy. How do we get calcium and prevent bone disease? Very specific topic. And then on a different day, we might be talking about diabetes. And a different day, we're talking about food allergies. We're talking about chronic diseases and risk reduction. So it's just a way to have fun and to actually tie it back to the science, to the literature, to our interprofessional colleagues that we're working with, and to make it real. Because if we talk in terms that aren't real to our patients, they can't go back home and figure out what to eat for dinner.
Totally.
So we are leading the charge. Actually, I run a committee nationally. How do we integrate food as medicine, culinary medicine into graduate medical education? And we're defining that right now. We're doing a national survey of the very few programs that are doing it, and learning from one another and hopefully setting the standard for how we integrate this educationally to change the face of cardiology. To, I mentioned gastroenterology, endocrinology, family medicine is a big program that works with us.
That is fascinating. Could you take us back to kind of the early days of getting the program off the ground? Like, what were some of maybe the either expected or unexpected challenges that you faced in those early days?
So there's always some of both, right?
Of course.
So when you do something different, most of the time people don't understand at first. And it's not that they wouldn't support you, it's that they haven't been able to understand why it matters, especially leaders. They have so many things in front of their desk every day, so many decisions to make, that you have to often explain what it is that you're trying to do more than once. So I think that's one of the biggest lessons learned is don't give up if someone doesn't get what you're talking about the first time. So we began to build this program. And actually, I remember this pivotal moment when Dr. Keith Argenbright, who is at Moncrief Cancer Institute and actually is the reason that I have an incredible culinary dietitian partner, and he's enabled her to be my colleague all of these years building this. He went with me when I got a meeting with my internal medicine department chair, Dr. David Johnson at the time, and Dr. Johnson listens to my spiel. He goes, okay, let's do grand rounds. You're going to give grand rounds and you're going to tell everyone about it.
Oh my gosh.
And this was in 2018. I was still fairly early in my journey. I'd never given grand rounds before, but he gave me an opportunity to share with a larger audience. And that was the beginning of people asking questions. And so sometimes you have to do something scary. You have to ask for help. And the answer that you get might not be what you were asking for, but it might be the thing that opens the door. And you have to trust the leaders who give you those opportunities. So that was definitely one of the lessons learned. And just as I train my residents, things go wrong, you get back up again, you learn from it, and you figure out how to frame it differently next time. So there were times that I would tell people about what we were doing, and I'm like, oh, that didn't land right. How are we going to say it differently next time? And so I think just getting back up again, having the resiliency and tenacity is key to anything new.
Absolutely. So how do you think about, I guess, first of all, within UT Southwestern, but also this national committee that you're leading, like, how do you think about kind of driving momentum in this culture change in our health system around making sure that doctors and clinicians across these different issue areas and disease areas are keeping food in mind as a real kind of driver of prevention and care? I
think I like to use the improv phrase that it's a yes and concept. So it is really key that we start with telling people we're not saying food replaces medicine.
Right.
If you have a cancer diagnosis, you need to do what your oncologist tells you to do and learn about how food could be part of the healing. And so I think that's key. We have to make this an evidence-based movement. This is not throwing out everything else. This is integration. And so when we're in an academic center, we have this incredible opportunity because we are experts in science, research, and public health messaging. How do we put it all together to say, this is what we know, this is what we don't know, and we're trying to figure it out. We're asking questions every day. We always want to learn. We're never going to land in a space and say we have all the answers. That's dangerous. We shouldn't be there. But when we're in an academic center, we pair research, we pair clinical innovation, which I'd love to share about next, and we pair education all together, and then all the boats rise, because we can train the next generation to think differently about whole person health. But then we can also innovate right now. Like, we don't have to wait until all the research is back.
Totally. Could you dive into that a little bit more?
Sure. So you've been to the doctor, presumably.
Yes.
What typically happens? You sit down, there's a conversation, you have an exam, you may be told what to do. We all run out of time. You might have more questions. I might have more I want to tell you. And I practiced in our primary care clinic for 10 years, seeing both children and adults. And I often felt like, there's so much more I want to give, so much more they want from me, almost unsatisfied. And I think many people feel unsatisfied, both patients and clinicians, that we don't have more time together and we can't go deeper on all the nuance. So what I really believe in is a concept that is not entirely new, but is definitely new when we're doing it in a kitchen, and that's a shared medical appointment. So we have actually launched a culinary medicine clinical care service line within primary care at RedBird Medical Center, UT Southwestern RedBird, and we see patients one-on-one in a collaborative model. So they spend time with me first. I'm diving into, why does food matter to all your health issues? What is your current treatment plan? How does food integrate? And then they spend time with my dietitian partner, who talks about, how do you turn this into dinner? How do we make this part of your life? What's affordable, accessible, and unapologetically delicious? Because we're never telling people to eat food that's nasty or boring, which is this bad brand around healthy food, which is not true, right? So we like to teach people it's not true, but it's even better if you can show them it's not true. So we take them to kitchens, and this is covered by health insurance. We come to kitchens in our community, and people check in, they get their vitals taken. It's a regular medical visit. They share their goals, their challenges, and it becomes a community of behavior change. And we run 6 classes with the same patient cohort over about 2 months. And they're going into a kitchen, they're cooking about 8 different recipes, and then they're coming back and we're walking them through the nutritional value of these foods, how you prepared it, what made it taste good, and how does this help your diabetes, your high blood pressure, your heart disease risk, and how are you going to take it back home? And then we're monitoring their whole treatment plan, adding food through a super practical lens to the toolkit.
Totally. And I'm so glad you brought up RedBird, because I think it's such a fascinating and deeply important project in Dallas. Could you talk more about some of the partners that you work with on that campus to deliver this care?
Okay, I'm glad you brought up the importance of partnership, because we have an incredible problem right now. We are sick as a country. We are the leading causes of death are related to food. And we have a broken food system too. And that's another topic. We could do a whole podcast on that. And there needs to be policy, and there needs to be changes in the way that we structure our food system to make the healthier choice the easier choice. But until then, we have to do something today. And so I think there's 2 main partners that I want to highlight. One is the charitable food system is doing incredible work. Many people have heard of North Texas Food Bank. They have lots of partners all over the city who are getting food close to where people live. Specifically, Crossroads Community Services has been a collaborator with UT Southwestern for probably about 15 years now.
Oh, wow.
It started before I came with a couple of my collaborators, Dr. Sandy Pruitt and Dr. Tammy Leonard in the School of Public Health. And they really built this model of, let's help you evaluate the outcomes of providing food to people. And so what we've been able to do is, with grant funding, we've been able to study referring patients directly from clinical care to getting food resources through the charitable food system on site at RedBird. So what does it look like if someone doesn't have to go somewhere else? They don't have one more stop to make. They are able to simplify what's already a complicated and stressful life. When you're short on food, that's incredibly stressful. And so now they can get food, and we actually are able to tailor it to health. And then we're able to study, does this make a difference in their food security, their quality of their diet, their diabetes risk, all the other things that are important to measuring health outcomes. And then hopefully we're saving money, right, down the line, because they're not in the ER now.
Yeah.
And we're able to really reduce the suffering that goes with chronic disease. So that's a key partner, is the charitable food system.
Okay.
Another key partner, which I'm so excited about, is our faith-based organizations. So we actually partner with 2 churches right now, Oak Cliff Bible Fellowship and Concord Church. They're kitchen hosts. So we've been able to designate them as UT Southwestern for several hours at a time. And we have formal lease agreements. And when we're there, they are UT Southwestern campus. And so our patients come in and they get a full UT Southwestern experience off-site in a really unique and novel way.
Incredible. Okay, so I think this is such a fascinating just kind of case study, what's happening at RedBird and happening in Dallas with UT Southwestern. Kind of going back out to the broader public health landscape, like how do you think about scaling a model like this and what you all are doing across health systems and really across our public health system in general?
Yeah, so I think about this constantly, and people are always emailing me like, how are you doing what you're doing? And we're finding ways to share. I'm actually excited to say that our concept just got accepted to a journal this past week. So I'll be able to share that soon.
That's incredible.
And we're also writing the story right now of how do you build a community co-led approach? Because one thing that I didn't say earlier that I think is key, we have no problem recruiting or retaining patients to this model. They want to come. In fact, our 4th cohort just graduated. We give them a graduation certificate and they're very proud of it.
Amazing. As they should be.
As they should be. They graduated on Monday, and 75% of them had nearly perfect attendance. It's across 6 classes. So they attended 5 or 6 classes. People show up over and over again. And the first thing they say to us is, we don't want it to be over, we want more. So I think one of the big take-home messages across all people in public health is people want more engagement, community, and support. How do we create that in a sustainable way? So this is sustainable because while we had a little bit of startup funding from a grant through our university's Clinical Translational Science Award, the CTSA, it is funded by clinical revenue, right? So we're billing payers, and they're getting a better deal, I might add, than if those patients saw me just one-on-one in clinic, because I'm able to give them real skills. So this model, I think, is immediately scalable. So I'm actually working with 2 faculty an oncologist, a gastroenterologist at UT, and then a pediatric gastroenterologist to look at what it would look like for them to build this into their practice model. So a physician could make this once a month, once a week, and it could be part of their day.
Okay.
And it would replace just a regular clinic. It's more fun. Everyone gets to eat, and you can see the same number of patients. So you're meeting what's needed in terms of access for our patients.
Right.
And so our next big growth area is we need to grow a team of culinary dietitians. So dietitians are nutrition experts, and we underutilize them. But part of that is because health insurance payers are not always consistent about covering them. We have a model where only I'm billing, so everyone's covered. But if we can train more dietitians who want to basically become chefs also, then you blend nutrition and deliciousness in the same person, the same educator. And our goal is to build a team and deploy them across clinics and campuses where physicians who are interested in offering this to their patients can do it without having to figure it all out, because we've already figured it out. We've got kitchens for you. We've got dietitians for you. That's really the way we're hoping to scale this locally. And I'm also in conversations with people all over the country who are trying to figure out how to scale it in their communities,
right,
which will require tailoring. Everyone's going to have a different color on, but this is scalable everywhere because everybody has kitchens, everyone eats.
Yeah, that is incredible. Okay, so I love hearing about kind of your go forward vision and goals. Where do you kind of see the ideal state of the program, like 5 years from now, 10 years from now?
Yeah.
What's next? I guess going along with expanding the team.
Well, I think UT Southwestern is set up to be one of the national leaders in this because we've been doing a bit of everything. A lot of people are just doing the research or just doing the education, but the fact that we've been able to build among many collaborators, including the School of Public Health has been an invaluable partner for me over the past few years in just building up the research portfolio. So we study it, we teach it, we're training the next generation. The residents graduating come to me and say, how can I make this my job? I want this to be my job, to deliver care in this way, because it is so rewarding and I see people getting better. So I think number one is we figure out how to optimize integration into education. And I think we've already got some lessons learned. And again, I'll be sharing that case series in the coming months of what we've learned from us and across the country. And then number two, we need to keep doing the work research-wise to show how do we dose this to which patients at which points in their journey of prevention and disease. But also we can't wait for the perfect answers there. We have to do it today because
Right.
people need help today. And so building a team to say, let's just mobilize more people doing this. So my vision would be that we have a broad team who's doing this across the community and across clinical settings while training people all over the country. I would love to be a training site where people come here
Yeah.
to learn, how do I implement this in my health system? And we can create a space for them to get a boot camp, basically,
Totally.
and then be able to deploy it, because there's no question that people want more of this. The patients
Yeah.
want to be in a kitchen learning with their medical team.
Absolutely. Okay, so for any listeners, and also I include myself in this group,
Okay.
who are inspired by your mission, how can we get involved? How can we be
Sure.
supportive?
Well, I think the first thing is in your personal realm of influence. Let's say you're ordering lunch for a team tomorrow. What are you ordering? Is there color? Are we being creative about ensuring that people get their fruits, vegetables, nuts, and seeds? Deliciousness is not sacrifice, but we need to be intentional about the food that we serve the people we care about and our colleagues and collaborators, okay? So what are you ordering for lunch when you're in charge? And then how are you thinking about it in your own personal life? That makes it real. And then when we think about how the community can surround this, I want to speak to some challenges. One is that Texas is now the top state for food insecurity. That is not the gold medal
The
we
top?
want. Yes.
Oh God.
And it is unacceptable. We have
Yeah.
1 in 5 children in Dallas are food insecure. How are they supposed to learn and thrive? They cannot. And food insecurity is often measured in the context of calorie or hunger prevention. And we need to shift to nutrition security, which means people actually have the right nutrition to thrive, which is not the same as just not being hungry. So there's a lot of work to do there. Who is leading that work? The charitable food system. But they have higher demand than they have ever had, and their giving is down. And so COVID really brought a lot of people to supporting charitable food system. Right now, they're not feeling the love. So I think thinking about how can we bring them in and partner with them as we continue to study these models together in a real world implementation way and help support their mission. So charitable food system's hurting. The NIH, we have some challenges ahead
Yes.
in figuring out how the shifts in funding that have been integral to advancing science are going to affect the work that we do every day. So I would love to see our federal agencies and the NIH continue to have shifts in the way that they offer grants towards other things. If we're going to be reducing how we support some areas, let's really lean into chronic disease. So I would love to have centers of excellence, which is a concept they've cleared around food as medicine. Would love to see that happen here so that we could begin to have the resources to truly scale and advance this as I'm talking about. So the philanthropic community is going to have to lean in to fill the gaps right now. And I think there's a lot of creative ways to do that. It's such a deeply personal issue, food and
Yeah.
health. And so I just encourage people to reflect on where does this hit you and how can you use that to as an individual, but also to build momentum in the community to support these endeavors, whether it's research, education, clinical innovation, supporting the charitable food system. There's room everywhere.
Absolutely. Well, really, really just applaud you for everything that you're doing, and thank you for everything that you're doing.
Absolutely.
So we are a podcast that really is about leadership.
Mhm.
I'd love to hear just your take and your experience leading this program. Like, how do you view great leadership?
So I think there's different types of leaders. And when I was early in my career, I got a lot of unsolicited and solicited advice. And what I struggled with most was integrating that into the fabric of my style and learning how you can take advice and feedback and input, and you should, but it doesn't have to be exactly done that way because that may be that person's approach. So we have to find authenticity in our leadership. And for some people, it looks very different than what my leadership looks like. So we don't need to try to fit one another's molds. We have to find out, where do we get a little tachycardic, right? Where you feel so passionate, so excited that you want to do more of that. So that's a personal journey. And it's sometimes others don't understand why you take the approach that you take, and be ready for that.
Totally.
So I think be ready to not be popular sometimes. I'm hear my daughter singing popular a la Wicked right now.
So good.
But you're not necessarily going to always be popular, and that's okay too, right? You have to say, let me take the hard feedback, but I don't necessarily have to always do it the way others would do it. So that's lesson 1. Lesson 2 is sometimes your mentors are books, because you might not have anyone that precisely is speaking into the spaces and places where you're struggling. And so I love reading, both Audible and I'm a library junkie, always checking out too many at a time, thinking optimistically I'm going to get through them all. But I think really listening to others who have gone through decades of learning, there's always something there. And then sometimes the people who have the most to teach us are not the traditional sources of mentorship.
Right. So, okay, we do have one question that we always ask. I'm
Yeah.
so glad you brought this up on our podcast, which is, who has been a mentor that's been just very influential in your career? And because you brought up books, I would love to hear both your book mentor and also your person mentor.
Okay, so I probably have 5 book mentors, so we'll
Okay.
have to narrow it down a little bit. Well, one of my first personal mentors who I attribute so much of my work to is actually my paternal grandfather, who we called Granddaddy. And he was a big part of my life. He was a USDA farmer on an experiment station in a small town in Texas. And actually, he got into college, and he started college, and he was the first one in his whole family. But his dad died suddenly right after he left for college, and he had to come back to run the farm. So he gave up his desire to get educated. And when I maxed out how many loans I could take out for medical school, he was the one who filled the gap for me to be able to
Wow.
finish medical school, and said, I want you to have the education I didn't get. He unfortunately passed away right after I got married.
Oh
but
my gosh.
one of the things he taught me, he would never knew a stranger. He was a small town country boy. And he said, Jaclyn, if you just talk to everybody, you'll find something in common. You can go from there. And I have lived that and found it to be so true. And in a time in which we are so divided in this country, we have to find something in common with everybody if we want to make forward progress. And sometimes that's more listening than talking, which I'm not very good at, but I'm working on. But so he's one of my mentors. My second mentor is Millette Seiler, who is my dietitian partner, and without whom I would not still be doing this work. We always say one of us can be ready to give up at any time as long as the other one is not. And so everybody needs someone like that, someone who doesn't let you quit.
Right.
And tells you just step out of the dugout for a few minutes, come back when you're ready. And we need those voices in our lives. And sometimes it's your peer mentors that get you through. And I have a lot of other really meaningful peer mentors at UT Southwestern as well.
Absolutely. Okay, what about the book?
Okay,
Your
books.
favorite books?
So I think one of my first reads that had a big impact was Getting to Yes, which is really about how do you negotiate? And I realized I wasn't very good at that because I thought everyone would just believe in it if I
Right.
just told them about how much it mattered. But sometimes you have to have a very clear objective. What do you want? What are you asking for? And maybe you don't always know what you're asking for, and you need to take a step back. And then you also, as I said earlier, you have to be ready to accept that sometimes you're going to be given something other than what you asked for, but it might be a blessing in disguise. So that was a big one for me. And then actually, one that I think is really important for women professionals is there's one called Nice Girls Don't Get the Corner Office. And it talks about how women in particular are bent towards pleasing. And part of that is because we're expected to please. And sometimes you aren't going to please, and sometimes you aren't going to bring the cookies, and you might not be liked by everyone, but you have to develop assertiveness and intentionality
Totally.
that isn't always accepted in our culture, especially in the South. And I'm doing work where I'm taking people into a kitchen, which also is a loaded concept.
Right.
And I've had pushback for that too. Like, why are we taking people to the kitchen? We're trying to get out of the kitchen as women. Like, well, no, this is different. But there's so much lived experience around why people perceive the way that we lead and how we find our authentic voice. And it's important to listen to the ups and downs of other people's stories, not just the rosy parts, but the hard parts too.
Absolutely. That's really good advice. Before we wrap up, can I ask you some quick rapid fire questions? Okay, so just first thing that comes to mind. The first one is, what is your go-to weeknight meal when you're short on time?
Oh, okay. So we actually have our kids trained to make it. It's bean tacos, not very exciting, but we make it exciting. So,
I find that very, very exciting.
all right. So my 11-year-old daughter, she can make these. So you just rinse some canned beans, which are a very healthy food, and you add some chili powder, cumin, a little bit of seasoning, a little bit of lime, a little bit of olive oil, warm them up. Then you toast corn tortillas, whole grain. We add a little olive oil to that too, just a little bit of salt and pepper. And then you start with the beans, and then it's like empty the kitchen sink. Okay, so you've got some avocado, maybe not right now, I don't know, they're kind of expensive. Tomatoes, I keep guac in the fridge all the time, so guacamole. Sometimes we'll use cabbage, lettuce, greens, whatever we have on hand, and it's build your own tacos. And it is so fun because my whole family just stands around the kitchen island throwing stuff on the tacos, and it's not hard. And it costs so little, and we didn't get takeout.
It sounds amazing.
Bean
My
tacos
God.
for the win. We probably have it once a week.
That's incredible. Taco Tuesday.
Taco Tuesday.
Okay, what is one ingredient you can't live without in your kitchen?
Smoked paprika.
Oh, okay.
It's a spice. It elevates everything. It also it almost has like a bacony flavor.
Yeah.
So if you're trying to cut back on processed meats, which we encourage, smoked paprika just livens it up. Avocado toast, put a little smoked paprika on it.
Good to know.
It'll
Okay.
elevate.
Who is your dream dinner guest, living or historical?
Oh, that's a hard one. I would have needed advance notice on that one. Okay. You know what? I'm gonna lean into the culinary space.
Okay.
And I'm gonna say, I think right now Jose Andres has done so much for the world food need and elevating the beauty of food, the connectivity that food gives us. I want to hear everything he's learned in his travels and as a chef.
Oh, that would be fascinating. Okay, what band or artist have you been listening to recently?
So Wicked, because I have an 11-year-old daughter.
Incredible.
And
That's all you need.
Seussical, the musical, because my son is in that. So I don't really get to make my own musical selections.
Okay, I love the musical theater, though. I'm a huge musical theater person.
That's what we're winning.
Okay, what is your favorite hobby outside of work?
I love to be with friends that are uplifting. And part of lifestyle medicine is spending time with people that leave us feeling better than when we started. And that doesn't mean they're telling you all happy positives. It just means their presence is soothing. And so seeking out time with friends, you have to be really intentional about it.
Yeah.
And sometimes it's virtual. But that's my favorite thing to do. Cup of tea, good friend, time in nature.
It sounds fabulous. My goodness. Okay, what is a comfort food that you love, still feels healthy?
Okay, I can't say red wine, I guess. I'm just kidding. No, probably my comfort food, and this is something that's true for everyone. We have a food memory that's tied to love. It is my grandmother's spaghetti.
Oh, sounds so good.
She simmered in green bell pepper that gave it a little bit of a kick.
Nice.
And I've healthified it, but it still hits the same way.
Yeah. Okay, what is one food trend that you can't stand?
Seed oil obsession.
Say more.
Okay. Well, all I'm going to say is that a little bit of fat in our food for cooking is absolutely fine. And it probably doesn't even matter so much what it is as long as it's in the right amount.
Yeah.
Where do people get most of their seed oils? They get it in ultra processed packaged foods, and they get it from fast food where your French fries have been dipped into that same oil all day long. That is the problem. It's not the seed oil itself. And we tend to miss the forest for the trees in nutrition these days, where people are obsessing over one tiny piece, but they don't eat fruits and vegetables. Drives me nuts.
Yeah. Okay. Is there a cooking fail that you are willing to admit?
Oh, a lot of cooking fails. And that's one of the things we love about Julia Child. We talk about her in classes sometimes. She would just throw it out. Like, that one's done. So I think I am a really good baker. I have 2 people with celiac disease in my home, and I rarely fail on baking, but sometimes my cooking is distracted because I try to multitask.
Yeah.
So just the other day, I thought I was going to make lots of meal prep vegetables. So I have a double oven, thankfully. I have 2 pans of roasted broccoli going, 2 pans of roasted sweet potatoes, and I burned all of it because then I tried to do something else.
Yeah.
So my one piece of advice is allow cooking to be mindful. Stay present.
Really good advice.
Use it as a time to put on some music, whether it's musical theater or something else, and just be in the kitchen, which is the center of many homes. Make your kitchen a space that you want to be.
Yeah.
And don't always try to be doing 6 things at once, even when life is frenetic.
Totally. Sing a show tune and cook away.
You don't want me singing. I'm just going to listen.
Okay. My last question is, what is your favorite restaurant around town?
I don't get out much right now. To be perfectly real, I love everywhere. I can find something that I enjoy everywhere. But one place that has really meant a lot to my family because it was one of the first places that we discovered that could accommodate my husband and son's celiac disease is Hugo's Invitados, which is in Las Colinas.
Okay.
And it is a kind of a farm-to-table approach on traditional Mexican cuisine with a ton of beautiful fruits, vegetables, seafood. They have a cauliflower mac that is incredible. Serrano
Can't go wrong with
cauliflower
that.
mash. They have the best Brussels sprouts that I've eaten in town, and they have incredible seafood dishes that I'm never disappointed by.
Okay, that sounds incredible. I'm going to check that out. Well, Dr. Albin, thank you so much for joining the show and for sharing your passion and vision for health and wellness. And to our listeners, thank you so much for joining us on Learning from Leaders. Be sure to follow us for more conversations with inspiring voices shaping our communities.
Thanks for listening to Learning from Leaders. If you enjoyed this episode, we invite you to subscribe now for monthly episode drops so that you can continue to learn from experienced business and community leaders to help you drive meaningful change in your community.